आप वहाँ बैठो और जजमेंट आपको देना है। नीति, before we start, a small introduction of by us. We have the moderator of our quiz as Dr. Dhanusha Goel sir. The scorer will be Dr. Ranjit. I will be the quiz master, and Dr. Nitin will be here to give out gifts to the audience. Okay. So we'll start with our first round, which is the warm-up round. In this round, you will be given 4 themes to choose from. There will be 2 rounds of questions to each team, plus 20 for the right answer, minus 10 for the wrong answer. The teams can pass, there is no negative marking on passing, and the team which answers the passed question will get 10 points. You will get 15 seconds to answer the question. Everyone clear? Okay. Team A, choose your Team A, choose your theme.
General reconstruction.
What is the definition of a flap? The timer starts now.
B.
Right answer. Plus 20 to team A. Team B, select your theme.
Can we select the theme again?
Yeah, yes. You can.
General reconstruction. General reconstruction.
Which of the following is not a method of microvascular anastomosis? Your timer starts now.
B mattress.
Right answer.
General reconstruction.
Which of the following is not a method of flap monitoring? Your timer starts now.
B.
Say the whole answer.
Photoplethysmography.
Wrong answer. Minus 10 to team C. Team D.
Head and neck.
The following is not a content of the left supraclavicular triangle of the neck. Your timer starts now.
Spinal accessory nerve.
You're correct. Plus 20 to team D. We have a second round of questions. Team A, choose your theme.
General reconstruction.
Which of the following is not a type of local flap? Your timer starts now.
D. Bakamjian flap.
You're correct. Plus 20 to team A.
General reconstruction.
Which of the following is a type 5 muscle according to Mathis and Nahai classification?
Latissimus dorsi. C.
You are correct. Plus 20 to team B. Team C, your theme?
Head and neck.
Xylography is a test to identify. Start.
D. Obstruction in salivary gland.
You're correct. Plus 20 to team C. Team D, your theme? Bilobe flap is used for the reconstruction of.
Nose.
You're correct. Plus 20 to team D. So everyone has done pretty well on the first round. The scores at the end of the round are we'll move on to our second round, that is the clinical scenarios round. There will be 2 rounds of questions to each team, plus 20 for right answer, minus 10 for wrong answer, and 15 seconds for answering. On passing, 10 points to the team for getting the right answer. Okay. We start with team D this time. Okay. 33-year-old female with BCC over left side of nose. What would be the best reconstruction plan after excision for a good cosmetic outcome? Timer starts.
D. Bilobe flap.
Sorry, I'm sorry. I think I'm sorry. I'll skip this question. I forgot to show the picture. I'm sorry. We'll do it again. Okay. We'll repeat. We'll do one question for you. Team C. We'll. 50-year-old male presented with soft tissue sarcoma over heel. On excision, the bone is exposed. Which local flap can be done for this?
B. Reverse sural artery flap.
You are correct. Plus 20 to the team. A 50-year-old male patient with recurrent soft tissue sarcoma over chest, already operated outside once for excision and reconstruction with PMMC flap. Which of the following free flaps can be used for reconstruction? Start.
Retrolateral thigh flap. D.
You are correct. Plus 20. Team A. 35-year-old male with defect over cheek following excision of a skin tumor. What would be the best loco-regional flap for coverage? Start.
C. Mustard flap.
Oh, that's good. Plus 20 to team A. I know. Yeah,
Then you
Yes, yes.
ask.
This is for team D. 80-year-old debilitated male patient, known case of CA buccal mucosa with poor performance status, operated once for reconstruction with radial forearm flap. Now having fistulous connection between the oral cavity and cheek. What would be the best plan of management?
Your time start now.
Your time is done.
Over. It's over.
नहीं कुछ नहीं हाँ The answer is lateral forehead flap. We begin with the second round of question from team A. 45-year-old male with 12 by 8 centimeter defect over back following excision of a large soft tissue sarcoma. What is the best option for locoregional flap reconstruction?
C. Transposition flap.
Sorry, that's the wrong answer. It is the keystone flap. Minus 10 to team A. Now team B, 50-year-old male with BCC over middle 1/3 of the ear. On excision, there is loss of cartilage and skin. Which is the best locoregional flap for coverage? Start.
If you don't know, then say you can say pass.
Cartilage graft plus
Over. Time is over.
Time is over. Any of the other teams would like to try? Now it goes to team C. You want to try?
Team C, you want to give the answer? You have no time.
No, sir.
Team D, you
Team
want to
D?
try?
A.
No. It's not. You are asking or you are giving the answer? A. Okay.
You are correct. Plus 10 points to team D. Now team C. The question is to team C. A 45-year-old male presents with a large fungating mass over the groin, known case of CA penis. On excision of lymph nodes, large defect over the groin measuring 5.5 by 4 centimeter is present. What would be the best locoregional flap for coverage?
B. Gracilis.
Sorry, that's the wrong answer. Minus 10 to team D.
You have option. If you don't know, you can pass the question. So it will not reduce your marks.
So the question to team D. Sensation to anterior 2/3 of tongue is provided by.
Lingual nerve.
You're correct. Plus 20 to team D. I'll ask a few audience questions now. If anyone would like to participate.
You can choose in audience.
Features of Gorlin syndrome do not include.
Anyone wants to give answer?
Mike. Hypospadias? You're correct.
Chocolate.
We can clap for Sushant. Yeah. Most common type of BCC. Anyone from the audience? You are correct.
Good.
Sentinel lymph node biopsy is useful in which of the following skin cancer? Any of? You are correct. So at the end of round 2, the scores are Yes, total.
So at present scenario, team A, how much they have? Team A 50, team B 40, team C 20, and team D 70. Wow.
Now we go to the rapid fire round. After this round, one team will get eliminated. There will be 7 questions to each team plus 10 for the right answer. No negative marking, no passing, and 10 seconds to answer each question.
Okay. Keep your mic. If you don't know, you can say pass. Okay. Team B 60 score. Okay. No, it's a 10
Sorry.
question, but if you don't know,
No, not passing.
no.
Not passing.
If one 7 question, first question is don't answer the answer, it can be also second question. It is not possible. All 7 questions you have to give the answer, but
And
you
there
can
is no
say pass.
negative marking in
There is
this.
no negative marking. So out
But
of
you
7
only have 10 seconds for the answer and 7 questions. You can go through the rules again, then we'll start with team A. Okay? Gold standard for mandibular reconstruction.
is only team A. Don't interrupt.
You're correct. Which of the following structure is preserved in MRND2?
Mike, please.
D. Spinal accessory of sternocleidomastoid and IG.
That's not right. Which of the following muscle is not a lip elevator?
Pass.
Minor. Zygomatic minor.
Wrong answer. Leech therapy is used to.
Reduce venous congestion.
You are correct. Up to dash percentage of lip defect can be reconstructed primarily.
50%.
That's not correct. Which of the following flaps is not used for lip reconstruction?
Mustard flap.
You're correct. Crane principle can be used for reconstruction of which of the following areas?
Cheek.
That's not correct. So you get 3 correct answers. Let's quickly go through the answers once. The gold standard for mandibular reconstruction, you have answered it correct. MRND2, spinal axillary nerve and sternocleidomastoid is preserved. Not a lip elevator is orbicularis oris. Leech therapy, you were correct. 30% of lip defect can be reconstructed primarily. Mustardy was correct. Crane principle is for the forehead. So they get 3 questions, 30 marks. Set 2 is for team B. We will start with them now. Nasojugal flap is used for reconstruction of.
Lower eyelid.
You are correct. Which of the following is not a subunit of the cheek?
Supraorbital.
You are right. Which of the following is not a level 2 oncoplasty?
Grisoti.
You are correct. The best reconstructive option among the following for reconstruction of lower inner quadrant defect in a patient having cup C breast size?
Pedicled LD.
Wrong answer. Which of the following muscle is a free functioning muscle transfer of facial palsy treatment?
Gracilis.
You are correct. Because of segmental blood supply of fibula, dash centimeter of bone can survive without loss of vascularity.
2 centimeter.
Wrong answer. Before starting microsurgery, the microscope should be prepared by.
Zooming out to least magnification and focusing till the picture is sharp.
That's not right. So you got 4 correct answers. Let us quickly go through the answers once. Nasojugal flap is for the lower eyelid. Supraorbital, you were correct. It is not a subunit of the cheek. Grisoti, you were correct. The best reconstructive option was superior epigastric perforator flap. Gracilis, you were correct for FFMT in facial palsy. Segmental blood supply of fibula, 1 centimeter of bone can survive. We have to zoom in to the most magnification and focus till the picture is sharp. Okay. Now we go on to team C. First branch of external carotid artery.
B. Superior thyroid artery.
You are correct. Micro dissection is a process used for
A. Prefabrication.
wrong answer. Which of the following is the dominant branch supplying pectoralis major muscle?
A. Clavicular branch of thoracic.
You are correct. Maximum reach of PMMC flap in head and neck is up to
B. Zygomatic arch.
You are correct. Rectus abdominis is classified into dash by Matheson and I.
Type 2.
Wrong answer. Blood supply of lateral arm flap.
C. Terminal branch of profunda brachii.
You are correct. So you got 4 correct. TFL flap is based on
C. Transverse branch of Latocell.
You are correct. So you got 5 correct answers. Very good job. Let us quickly go through the answers. First branch is superior thyroid. Micro dissection is used for flap thinning. Dominant branch supplying pectoralis major is correct, thoracoacromial. Maximum reach of PMMC is up to zygomatic arch. Rectus abdominis is type 3. Blood supply of lateral arm is terminal branch of profunda brachii artery. TFL is correct, transverse branch of lateral circumflex femoral. So the score for them is, in this they got 5 correct answers. 5 correct answers. Okay. The last set of questions to team D. What is a Becker's flap?
Dorsal radial artery. A.
Wrong answer. Blood supply of posterior thigh flap.
C. Deep circumflex.
Wrong answer. Which nerve supplies tensor fascial atom?
Mike, please.
C. Superior podial nerve.
Wrong answer. Who described the perforasome concept?
C. Iron Taylor.
Wrong answer. Between which two muscles should osteotomy be made on the radius during harvest of osteocutaneous radial artery forearm flap?
Pass.
What is the size of vessel anastomosed in supermicrosurgery?
A. 1 mm.
Wrong answer. Mechanism of action of heparin?
B. Antithrombotic.
What was your answer? You are right. So you got 1 correct answer during the rapid fire. Let us quickly go through the answers. Becker flap is a dorsal ulnar artery flap. Posterior thigh flap is inferior gluteal artery. TFL is supplied by inferior gluteal nerve. Perforasome concept is given by Michael St. Cyr. The osteotomy should be made between brachioradialis and pronator teres. Vessel anastomosed is 0.8 mm and smaller. And this was correct. Anyone from the audience would like to play a rapid fire? You can come down here and take the mic. 2 of you can come down. Acha. Please welcome them with some applause. इधर ही आ जाओ ना, इधर आगे आ जाओ.
Come forward.
Give a small introduction about you. Mike.
My name is Dr. Smith Patel. I am currently fellow at HCG Hospital, Baroda.
Myself, Dr. Dhruv Patel, MCH plastic surgeon, currently as a fellow in microsurgery at BMC HRC, Bhagwan Mahavir at Jaipur.
Okay, that's great. We welcome you to the rapid fire. Okay, we will start once you're ready. Start. Which is the chemical substance in saliva of leech that aids flap salvage?
Hirudin.
Correct. Dedicated microsurgical robot is?
Da Vinci.
Wrong answer. Which flap is popularly known as a Chinese flap?
Radial forearm.
You're correct. Percentage of population in which Perona magna is expected?
10 to 11.
Wrong answer. Which of the following can be used as a flow-through flap?
Anterolateral thigh.
You're correct. Type of tissue transfer in which different components of tissue, skin, bone, muscle are transferred with separate supply but having a common pedicle.
Chimeric flap.
You're correct. Blood supply of ALT flap is based on?
Ascending branch of LT.
You're correct. So you get 5 correct answers, so you get 5 chocolates. So yeah, please tell the scores. And after this, one team will be eliminated. Okay, we are sorry, Team C, but you are eliminated. But we can still give them a good round of
But
applause.
good-
They
yeah,
have
good
had.
job.
Yes, yes.
Good job.
We will move on to round 4 now. नहीं नहीं बुरा नहीं है, फिर एक और टीम एलिमिनेट करना है. हाँ एक और करना है. हाँ हाँ इसमें से वो सी को हटा दीजिए. This is round 4 is the visual round. We will be showing you an image on which the question will be asked. There is plus 20 for the right answer, minus 10 for the wrong answer. On passing, 10 points to the team which answers the question, and there's 15 seconds to give the correct answer. Okay. Team A, we will start with you. The following images show 2 types of usage of a commonly used flap. What is the Mathis and Nahai classification of this flap?
Type 2.
That is not right. Any of the other teams would like to try? Team B? Yeah.
Type 4,
No. Team C?
type 3,
It is a type 1 flap. नहीं कुछ
No, no, no,
pass
no,
कुछ
minus.
नहीं, हाँ. Team B, the question is for you. Mention any 3 uses of this flap other than in post-cancer reconstruction. Okay, since you have not answered, there is also no negative marking. Any of the other teams would like to try? Team D? ये तो D.
it is a rectus abdomen.
Louder, please.
Please talk in the mic.
Hello. Please talk in the mic, louder. No, then you can say no.
Team A, you want to try? There's no negative marking on answering a past answer. You can just guess.
Breast augmentation, one use.
Okay. Breast augmentation.
Memoplast.
You want to give any other answer? Which flap is this?
Rectus abdominis.
It is a diap flap.
Diaphragm.
Yeah. This is them. So there is no points in this round to any of the team. हाँ पता है हाँ. Next question is to team D. Okay. Specify two uses of this flap, one as pedicled and one as free.
One for pharyngeal reconstruction and another for esophagectomy, total laryngectomy reconstruction.
Okay, I'll give it to you. Which flap is this?
Jejunum.
Okay, you are correct. Plus 20 to team D. Team A, identify the condition in which this flap is being used. Your
Pass,
time's
pass.
up.
Time
Any
over.
of the other teams? Team B?
Your turn will come. Wait.
Pass.
Team D?
Facial reanimation.
No, this is not facial. Which flap is this?
LD sorry, LD.
It is a parascapular flap which has been used for hemifacial atrophy, that is Romberg syndrome.
They ask the condition.
Now the question is to team B. Mention 3 uses of this flap in different types of reconstruction.
First, it is gracilis flap. First, anoplasty.
Okay.
Then second is groin defect,
Okay.
and facial reconstruction.
Okay, that's great. Plus 20 to team B. Team D. Identify the reconstructive geometric principle used in this flap for breast reconstruction.
If you don't know, say they pass.
Pass.
Time तो होने दो. Time. Okay. Team A.
Tissue elasticity.
No. Geometric principle. Which geometric principle is used in this flap? No. Team B.
Rotation.
Yeah, okay. But since they answered for, so team B will get 10 points in this. One question for the audience. What is the use of this diagnostic modality shown in the video?
Indocyanine green.
The question is, what is the use of this modality? DG Vijay sir, you are not allowed to answer.
Patency of
Yes, please. बोलो बोलो.
patency of microvascular anastomosis.
Okay, we can give it to you. This is indocyanine green angiography. It is a real-time imaging technique. Uses near infrared fluorescent dye to enhance the surgical precision. Uses are for intra-op imaging, monitoring tissue perfusion, and diagnosing ocular pathologies. The scores at the end of this round are. Ranjit score.
Score, please. $70 for Team A. Team B 130. Team D 100.
That is a great effort. Team B is leading is with 130. Sorry, we will have to eliminate Team A, but we will give them a huge round of applause. The last round is the buzzer round between the two teams. Buzzer aap hi do. You can move ahead
Yeah,
closer to
you
the
can move
table
ahead.
for the buzzer. Please check your buzzers once. वो बॉटल हटा दो ना तो हाथ दिख जाती है. बॉटल यहाँ नीचे रख दो. बॉटल हटा दो तो हाथ. So Dhanush sir will be deciding who is hitting the buzzer first. Okay.
If without. Yeah.
The rules of the team are the team which hits the buzzer first will get to answer first. There is plus 20 for the right answer, minus 10 for the wrong answer. Minus 20 if you answer without hitting the buzzer. There is 15 seconds to answer and no passing. Okay. Clear with the rules?
So understand?
Shall we start? We have questions for the audience. Yes. Okay.
So are you ready?
First question. What is the line shown in the image and what is the significance?
Wait.
किसने सर आंसर किसने किया?
Congruence line.
Don't
मैंने बोला
answer
कि किसने
without
पहले दबाया, किसने वो बजर दबाया पहले बोला.
क्या करना है -20?
नहीं कुछ नहीं. नेक्स्ट क्वेश्चन. मैं बोलूँगा.
Okay. Please be very careful. Okay. Anyway, we'll give the answer. Anyone from the audience wants to give the answer? And what is the significance of the line? All of you cannot get the chocolates. Or sir, आप बोल दीजिए. Yes, that's right. So the tumors which are above this line will have a comparatively worse prognosis and rapid spread.
So first read the question. Buzzer. I will decide who will.
Okay,
give
teams
buzzer
be
and then
very
give the
careful.
answer. You have 15 seconds.
Because the scores may change rapidly because of the negative marking. Okay. We move on to the second question. Axillary lymph nodes are divided into 3 levels by which muscle?
Ime.
Pectoralis minor muscle.
You are correct. Plus 20.
Very good.
Identify the structure marked by arrow.
Team B.
Vagus nerve.
You are right. Which technology is being shown in the image for mandibular reconstruction?
B.
CAT
Team B.
Sir, CAT cam.
You are right.
You have 15 seconds.
Which flap is used for lip reconstruction in this image?
Team B.
Carapancic.
You are correct. Which flap for eyelid reconstruction is shown in the image?
Team A.
Mustard flap.
That's wrong. -10. Anyone from the audience wants to answer? Yes, Smith. You are correct. Spot diagnosis. ये रहा. टाइमर नहीं पर अच्छा ओके चलो हाँ. Okay, since none of the team wants to answer, we will give the answer to Bakshi sir. You are right, sir.
2 chocolate for Bakshi sir. Okay.
Most common parotid tumor to show perineural spread.
Team B.
Adenocystic carcinoma.
You are correct. Full form and structures removed in SOHNDR.
Team B.
Supraomoid neck dissection.
Okay.
Level 1 to 3. Lymph nodes.
Say the complete answer
Level 1, 2, 3.
with the names.
Level 1 submental. Level 1B is submandibular. Level 3 upper jugular. Mid jugular.
Okay. Plus 20 to team D. Okay. Branches of facial nerve in pes and
Team A.
superior temporal, then zygomatic, buccal, in marginal mandibular, and cervical.
Okay, you are right.
Correct.
Very nice. Mention any 3 commonly used free flaps with their blood supply.
Team A.
Anterolateral thigh flap, supplied by the inferior branch of the circumflex femoral artery. Radial artery, forearm flap, supplied by the radial artery, perforators from the radial artery, and
Flap superficial circumflex, superficial circumflex iliac artery flap.
Okay. So plus
Very
20 to team B. So final scores are
Oh my God, it's tie, huh? Okay, to team A 180, team B 200.
so team D is the winner with a great score of 200 points, and team B is the runner up. You still get the prize. You get a runner up prize with 180 points. We applaud you all for your efforts, and that is great. Thank you, Dhanush sir.
Actually, to making this all questions and answer, Dr. Nirmala did a very good job. Actually, it's required for the applause for her. Last 5
Thank you,
days,
sir.
she is with busy schedule and all these things. She actually did a very good job.
Thank you,
Thank
sir.
you, Nirmala.
Thank you, sir.